Hello, we're here with Prime Neurology. Dr. Goel is going to answer some frequently asked questions about nerve tests and EMGs. Dr. Goel, what is an EMG and a nerve test?
Great question. We do get a lot of calls for nerve tests and EMG. Nerve test is study of the function of the nerves. We see how the nerves are conducting, how fast they're conducting. During EMG, we study the muscle activity to see whether it's a normal pattern versus an abnormal pattern.
Okay, when would you deem necessary
The test?
to do the test?
So nerve tests and EMGs are done for, there's several indications. So a person could have tingling, numbness, burning sensation, any or all of those symptoms in their feet, in their fingertips. So you would do a nerve test, an EMG for that. Patient could have neck pain radiating into their arms, or a lower back pain going into their legs. We would do a nerve test EMG for that to see where is the pinched nerve, and also to see how much is it affected. We would also do nerve test EMG for patients who we suspect might have carpal tunnel syndrome, or cubital tunnel syndrome, or Lou Gehrig's disease, ALS, that is, and myopathies or muscle diseases or muscle inflammation. So there's several conditions for which this test is indicated.
Okay, so what can we expect when somebody gets a nerve study or a EMG?
Great question. So a lot of people fear the test because they've heard that it's very, very painful. The way I like to describe it as, it's an uncomfortable test, but it is certainly, it's not super painful. So the test is done in two parts. The first part is the nerve testing part, and the way it works is we have to give small electrical shocks to the nerve to see how they are conducting. And in the second part, which is the EMG portion of it, we have to study the muscle. And the way it's done is there's a small needle that has an electrode at its tip that you put inside the muscle to record the electrical activity of the muscle. There is no shocking in the second part, it's just recording. But because there's a needle involved, it can be a little uncomfortable. I would say in my several years of practice, maybe there's been one patient who has said, Dr. Goel, it's super painful, I cannot tolerate the test, let's stop it. And we had to, we stopped the test. But most of the patients are able to tolerate it very well. If there is discomfort, it's mostly limited to the time of the study, and once it's done, it's done. There's no lasting discomfort. And so I would say, yes, the test is uncomfortable, and I wish there was a more painless way of studying the nerves and muscles, but unfortunately there isn't. But I would say that the data that we get from the study is very valuable for helping with diagnosis and to help with treatment.
Okay, so then you would deem it that it's safe?
I would. I think it's a very safe study. There are certain scenarios where we would avoid stimulating certain nerves if the patient has a pacemaker, for example, but otherwise it's considered a very safe study.
Okay, Dr. Goel, thank you. That was so helpful. There was a lot of helpful information, and I'm sure that our patients will greatly appreciate it.
It's a pleasure. Thank you for doing this.